Okay, excellent. I'm not sure if you want to all show your screens now, even if you remain muted. Wonderful. Hi, Katherine. My understanding, Katherine, is that you'll be monitoring the technical side of things during the session.
Yes, yeah, I'm here to, well, I guess we don't have a lot of attendees, but if you have questions for each other, I'll be watching the chat there.
Super.
Muting people if I hear weird noises in the background. That
Fantastic. So we're going to go ahead and get started. I was unable to share the link to the Zoom meeting with my global health class, which was unfortunate, but I will share the recording afterwards. So I really want to thank the 4 presenters today, all of whom are in my class on the global health crisis and are here to share their individual research and their collective analysis of state-level responses to the coronavirus pandemic. My name is Kristin Yarris. I'm an associate professor in the Department of International or Global Studies, and I direct the Global Health minor program here at the University of Oregon. And I've been working with all 4 of these presenters this term in a 400 level class that has substituted for the Global Health minor field experience in these times of crisis. And I'm really proud to be a part of this work, and the 4 presenters have put a lot of effort into their projects and a lot of creative original thinking into how to display their work in ways that engage broader publics. So while they're presenting today sort of using traditional PowerPoint slides, they're also going to be sharing with you the ways they've used social media and other forms of technology to share their work with broader audiences, which is fantastic. So I'm just going to go ahead and turn it over to the panelists. Thank you so much for being here today. I'm going to mute myself.
Hi, thank you. So I am going to start it. So I'm just going to share my screen now. If everyone can just let me know that they can see it. Cool, perfect. Okay, so as Professor Yarris said, we are doing a coronavirus response by state. So all 4 of our panels are focusing on, panelists are focusing on a different state, such as Colorado, Oregon, California, and New York. And at the end, we'll have a comparison of all the 4 case studies with a Q&A and comparison. So to get started, I did my case study on Colorado's response to COVID-19. To begin, this is just kind of a timeline of Colorado's local response to coronavirus. So on March 5th, we had our first confirmed case. And then on March 10th, our governor, Polis, actually declared a state of emergency. It wasn't until March 18th that we had our first death. And then on March 25th, we had our stay-at-home order implemented, which everyone knows, non-essential travel, stay at home, only go out for groceries, medicine, and anything essential, such as exercise, that was also allowed in Colorado. And then it wasn't until a month later that the phase 1, it was the start of the reopening of the state of Colorado, and our governor called this safer at home, was implemented on April 26th. So this is the website of, it's called the Colorado Department of Public Health and Environment. We call it CDPHE. This is the website that the citizens of Colorado use to actually get our most up-to-date information regarding the state. As you can see up here, this is the COVID-19 in Colorado section. This is the safer at home section. It's just a really good website to get true and accurate information quick and get the good details about it all. Oops. So as of May 20th, I hope you guys can see this and our faces aren't over the screenshot, but as of May 20th, this screenshot was actually taken from the website I was just talking about. We had about over 22,000 confirmed cases there, and only about 20% of them were hospitalized, which is pretty standard for coronavirus. As you can see in this graph, the yellow line is the percent or the number of cases hospitalized, and the red line is number of confirmed cases. And then total deaths, and May 20th was yesterday, in case you guys didn't know. And so the number of deaths that we had was about over 1,200. But interestingly enough, beginning on May 15th, the number of deaths, the way that they totaled this number was actually different than prior to May 15th. So prior, they just used any death that involved COVID-19. However, beginning May 15th, they actually changed it and separated this into two different groups, where the first number of deaths are people who just had COVID and not necessarily died from COVID. And the second group of people is where on their death certificate, the cause of death was COVID-19. So the number of deaths written on all these statistics is a bit skewed. And so I think it's important to keep that in mind, that the cause of death may or may not have been COVID-19 in those statistics. So for another timeline, these are just executive orders given by our governor, Polis. These are just kind of the main important ones that directly affected the majority of people in the state of Colorado. So March 10th, state of emergency due to coronavirus. And then March 14th, this was kind of a devastating one for Coloradans because the ski slopes were closed. And then on March 18th, online schooling for secondary and elementary schools. And Governor Polis actually extended the tax payment deadline. So those people who were laid off, who were dealing with financial stress, they had a lot longer to actually pay their taxes and write that in. And it's actually still being extended to this day. So that's obviously helping people who are in financial stress. Again, March 25th is that stay-at-home order. These are all executive orders. And funny enough, April 17th is when he actually started the essential business staff are required to wear masks. So prior to this, majority of essential business workers were wearing masks, but it wasn't required. And so on April 17th, it actually became a required order that the workers had to wear the masks unless you physically had some sort of reason that you couldn't breathe in it or whatever it may be. And then April 26th is the phase 1 reopening safer at home. And I will get into that right now. So this phase 1, obviously the level 1 is the stay at home order, which most states went into. And like I said before, you're required to stay home except for that essential travel. And then on April 26th, we had this safer at home, which it was actually the last day of the stay at home order. So it technically started on the 27th. And this included curbside retail, real estate showings opened, but open houses were still not allowed, but you could go and look at houses to buy. And then it's just a slow process. So May 1st, retail and personal services can open. And then on May 4th, non-critical offices could now open if you were implementing safe measures. So this includes like sitting 6 feet apart from each other, wearing masks, having sanitation stations, whatever it may be to prove that you are implementing good practices in order to keep your business open. So it's a slow process, but it's working. And I'm sure a lot of you saw on national news that one cafe in the state of Colorado opened and had about 50 people in there. No one was wearing masks. It was a very crazy opening, and they did it. The owner of the business was actually interviewed and said he was doing it because he was going bankrupt. It's a very sad economic hardship that we do understand, but you also have to put the health of others in and keep that in mind. And that business actually lost their business license because they opened and they didn't follow the guidelines of the executive order for implementing the best safe practices while open. So one of my focuses was the healthcare workers' perspectives. So I got to interview 3 people. 2 of them are frontline healthcare workers. One's a PA in primary care, and one is a pediatric registered nurse in Denver. And the PA is in Colorado Springs. And the 3rd person I interviewed was the former deputy director of the National Immunization Program for the CDC and Prevention. And he had this title during 1994 to 1998. And so I'm not going to be able to show you the whole video, but I'm going to show you some segments of the interviews that you guys can see kind of their perspectives and their opinions on how the state of Colorado has handled it. And the former CDC deputy director will give us more of a federal view of it. So this is just going to be a few segments of the interviews themselves.
Over 75,000 people have died in this country. and that's a huge number. And if the number's only going up and they're predicting so many deaths per day, that's very, I mean, this is very scary times anyway, but it gets more scary as we think about more about the future. I think all in all, our state has done a really good job. From where I sit, from what I see down in El Paso County, which is the second largest county in the state, I think Jared Polis was on top of it pretty early, and I think he was pretty firm in following the guidelines and getting everything shut down when he did. And I think because of that, we're not up there with New York or some of the other states that have had as many deaths.
Both nationally and like locally, things could have gone better, or we could have been more prepared.
He's certainly been a leader, which is what we need in this time. I want him to continue to be a leader and to continue to be providing information and also following the guidelines from the professionals and not being one of those states that says, screw it, we're going to open up like Florida or Georgia or, South Carolina.
And I'm going to just fast forward to this segment that talks about what we need to do moving forward and what they think the most important factors are with that. If my mouse would work, it's right.
A better supply of all of our PPE and like supplies that we need at the hospital, and then education for the community. I think that would have played a huge role in this, like with the media and just different sources with differing information. A struggle that we had with the like CDC was it felt like they were changing their policies like every single day. Like, so we'd come to work one week and a policy would be do this and this and this, and then we'd come to work the next week and it'd be like, oh, those changed.
A vaccine that works, that we know is going to work, good antibody testing that really is valuable. Like right now, antibody testing is worthless, and I think we need to be careful about what we say to people about antibody testing. We have to be very careful with our words as providers, and we all have to know what's going on. We can't just be passing out information that's not accurate. I mean, antibody testing is exciting in a way, but even if it says it's 93% specific, that's a horrible number, because that means you're going to get a ton of false negatives or a ton of false positives. And we need to know what we're testing and why.
In this country, to really feel comfortable, I don't think that day can come until we have a vaccine and we've probably vaccinated 75, 80% of the population. Because I think at any given moment, if the disease is circulating in the population that is unimmunized or is previously uninfected, I think that people will always be at risk.
That's going to be a long-lasting problem. Our country's not going to bounce back for years from this.
They need now to guarantee widespread testing. They need to put in place the very best possible contact tracing program that they could, led by CDC, even though the management of it on a day in and day out basis would occur in state and local health departments.
Okay, I'm just going to stop it there, but that's just some segments of the interviews that they were very kind to answer some questions about it and give their perspectives on the local and federal response to COVID. And so just the major takeaways from this is in Colorado, our governor, he responded to coronavirus as well as he could with the resources that he had. And he was a very good leader, as you heard in that interview. He set a good example for everyone. The parts that I didn't show you in the interview, the nurse and the PA were both very short on PPE, as were other states, obviously. However, these two important women in healthcare, they said that they have one N95 mask, and luckily the pediatric nurse was able to, their hospital was able to figure out a way to sanitize these at the end of each day so they could reuse them. But the PA in primary care, she's been wearing the same mask for 2 weeks, and you can't wear it forever. She says she's got to figure out a time to throw it away, but she doesn't want to do that until she has a new one. So PPE was a big issue here in Colorado for hospitals and local clinics, wherever. Overall, it was pretty controversial if the state of Colorado opened up too soon. Based on our numbers, obviously in this graph to the right, the number of cases has been declining. So we opened up around April 26th, or began phase 1. And obviously it's been a decline, but there's been a few hiccups here. And so we're getting lucky and the cases are declining, which is good. But people are still very scared there's going to be a second wave and it's going to hit worse than the first. So ultimately, we need vaccine, we need antibody testing, and we need contact tracing. And those were kind of the three main takeaways that the three interviewees said that are the most important factors to get through this and moving forward to focus on. So that is the end of the Colorado one. So questions again will be after all 4 case studies, and stay tuned for the other one. I'm going to stop sharing my screen now.
All right, I believe my presentation is next. I did a case study in Oregon, so I'll go ahead and share my screen. Can everyone hear me okay? Was that an okay on the hearing? Okay, great, thank you so much. So just to introduce myself, my name is Hannah Heskin, and I am currently a third-year human physiology student at the University of Oregon. So today I'm going to be presenting on the novel coronavirus outbreak and state-level response here in Oregon. So just to share some of my motivations behind this project, first of all, like Professor Yarris mentioned, I'm a global health student. I'm pursuing a minor in global health, and a lot of our internship opportunities were canceled. So I was really thankful to have this opportunity to engage with the global health community remotely. I'm also an Oregon resident, and I'm very passionate about the health of my community. So I was glad to be able to look into how the pandemic is affecting my state. My main research question was to look into the epidemiological profile of the outbreak, as well as the state level response here in Oregon. This is really important because we will most likely face another public health crisis in the future. And I think it's good to look at our actions so we can be better informed for future responses. Okay, so I wanted to share some of the resources that I used to collect my information. For the information on case numbers, I relied heavily on the Oregon Health Authority website. They send out daily emails if you sign up for that. And I also used the COVID projections created by the Institute for Health Metrics and Evaluation, which is a global health research group based out of the University of Washington. I also wanted to investigate specifically the governor's actions. And so her Oregon.gov website was a great resource for that. It laid out all the executive orders and press briefings. The governor also created a COVID-19 resource page, which was very similar to the one used in Colorado for residents to access. Another way that I presented my information was in the form of an Instagram account. I chose to use Instagram because it was a way to graphically present just kind of the key bits of information. I know there's a lot of news about coronavirus, so I wanted to show that in a very accessible way. So here's just a quick screencast of what my account looks like. And I was just glad to have the opportunity to kind of interact with some other coronavirus accounts to see what was happening on the more worldwide scale. Okay, and I did just want to note that, as we all know, this is a very rapidly evolving situation. So the information in my presentation is up to date as of May 17th, which was just a few days ago. To share some of the epidemiological information for the state of Oregon, our first case was on February 28th, which was about 2 months later after it was announced globally. Our first death followed about 2 weeks later on March 14th. And then I also wanted to look and see the kind of jump in case numbers between our stay-at-home order, which was around 200 positive tests, to the time when we've moved into a phased reopening, and that was around 3,500 positive cases. Currently, there's 3,623 infections and 37 deaths. I wanted to start off with just showing a map so we could see the spread of cases in Oregon. And as you can see, most of the numbers are populated in our more metropolitan areas, which makes sense with denser living conditions, whereas rural Oregon saw very few cases throughout the whole process. Okay, next I want to examine Oregon's state level response as seen by the the actions of Governor Brown. So this is just a brief timeline showcasing the key social distancing policies that the governor set up, and she used executive orders to put all of these mandates in place. The first main one was on March 12th, where we banned gatherings of more than 250 people. And just 10 days later, we had progressed to a full stay-home order. So there was a few steps in between, such as closing schools and stopping non-urgent procedures in order to preserve PPE, which was also a problem here in Oregon. And looking back, that 10 days seems like a short time, but I remember kind of living through that time and the uncertainty of what was going to happen, were we going to close, were people going back to school, and it just felt a lot longer in the moment. So through my research, I really dove into all of the executive orders that the governor used, and I found that most of them could be put into 3 different categories. First, to mandate social distancing policies in order to slow community spread. And second, there was quite a few executive orders concerning economic relief. The governor banned commercial and residential evictions to make sure people didn't lose their homes and businesses, and she also took action to protect CARES payments, which was the federal relief funding, just to make sure those weren't taken by debt collectors and things like that. And then the third category is the governor's policies to move Oregon into reopening, which I will get into. So it was Executive Order 2025, entitled A Safe and Strong Oregon. This is our plan for moving the state into reopening. It's in 3 phases, and the phases are used on a by-county basis. So right now, most of the state has moved into phase 1, which allows limited reopening of things like restaurants and bars. The next goal will be able to move into phase 2 with higher risk activities. And then phase 3 is our ultimate goal of mass gatherings, such as concerts and live sporting events that we all want to get back to, but unfortunately, that likely won't happen until we have a vaccine or really reliable treatment. So here's a map just to show how much of the state has already moved into phase 1. Phase 1 was able to start on May 15th, and counties applied to the governor, and if they met the recommendations, they were able to open into phase 1. So on that day, May 15th, 31 of our 36 counties were able to move into phase 1 of reopening, but 3 counties did not apply and 2 counties were rejected. And you can see that the counties that haven't opened yet are where the higher numbers of cases were. Okay, and now to move into some analysis of my findings. I wanted to create this graph to kind of show the more quantitative side of my research. So I found that from the time of the start of the pandemic to now, the governor issued 21 executive orders, had 55 press releases, and partook in 8 live briefings. And she always did these briefings in conjunction with the Oregon Public Health Division, and those were all streamed on her YouTube page. Okay, so I also wanted to really investigate who is advising the governor. Where is she getting her information to make all of these really big policy decisions? So first of all, she worked closely with state officials. She created a coronavirus response team, which had representatives from 12 different government agencies here in the state. She also included county chairs and city mayors in her daily press briefings. She also worked with the Oregon State Park System, because here in Oregon, we love to go outside, and people were flocking to our open areas at the beginning of the shutdown, which was putting a lot of strain on those communities. The governor also worked closely with public health leaders and scientists, including the Oregon Health Authority and the Public Health Division. Her live press briefings always featured people in that position. The state also collaborated closely with the Oregon Health and Sciences University to conduct a testing study of COVID-19 to really see where the hotspots are in the state. And the governor has also cooperated with our neighboring states through the Western States Pact, and that's just a kind of a unified reopening plan between the governors of California, Washington, Colorado, and Nevada. Okay, I also wanted to investigate kind of the public reaction. The governor is making all these big changes, trying to take action and keep everyone safe. So how are people responding? And of course, I found positives and negatives. On the positive side, there was a survey done by the DHM research group in mid-April, which found an 82% support of the statewide stay-home order out of 900 participants. And also on the governor's various social media pages, I found a lot of comments of thanks and support, and people just really appreciating her efforts. And then of course, as in other states, there were some negative reactions. Oregon did have a reopen rally, which was at our state capitol, and that was on May 2nd, and those people were protesting the stay-at-home order. There was also a case of a salon owner in Salem who opened her business in defiance of the order, and I found in the news that she later was fined from doing that. Okay, so just to share some of my concluding thoughts, through my research, I was very surprised to learn how much power the governor really has. Our governor was able to act swiftly and take action, and it really did help us flatten the curve here in Oregon, as we have a relatively low number of cases. Oregon, I think, is also a really good example of the success that comes with collaborating between state leaders and public health officials. And I also found from my research into kind of public opinion is that prioritizing public health, especially when you have to balance that with economic well-being, is not always the most popular choice. And just to finish, I have my sources. Thank you.
Hi, so I will be going next. I'll go ahead and share my screen. So my name is Myriah Kunipo-Aguirre. I am a human physiology major with minors in global health and anthropology. I have been following California's COVID-19 response with a focus on Los Angeles County. For our project, I decided to choose the social media platform of Twitter. For this, it allows me to quickly link articles together, curate information on the current topics and executive orders, and also create threads and add my own analysis towards the topics that I have been following closely. So I'll just start with a quick update on cases. This is the numbers as of last night, yesterday, May 20th. For California, here's our total confirmed cases of 85,913. For Los Angeles County, we currently have 40,857, and this number does include reported cases from Long Beach and Pasadena's respective public health departments. Just to note, Los Angeles County is home to about 10 million residents. So we currently make up about 47% of the total confirmed cases in California. And here are the few areas of interest that I have been focusing on. For overview at state and county levels, that includes unemployment resources, the progress of reopening, and also our executive orders from the governor and our mayor. For the community resources and assistance, that includes food banks, food programs, childcare programs that have been implemented, and also financial assistance located locally for residents. And for the impact on California's industries, that includes our sports, our amusement parks, our events, our public parks, and also our beaches. And here I just wanted to quickly note the sources that I have been following. For California, I have been following the Office of the Governor, Gavin Newsom, also our California Public Health Department and our California Public Health Director, Dr. Sonia Angel. These are their official Twitter accounts. And for Los Angeles County, I've been following the Mayor, Eric Garcetti, Los Angeles County's information site, and also the Public Health Department, and also the news local news outlets, and Los Angeles Times. So I'll quickly switch over to just share my Twitter page. Can you all see this? Okay, so here's my Twitter page, here, my profile. As you can see, I am doing the COVID-19 California response with the emphasis on the Los Angeles County. Here's my timeline of my curated tweets that I have been following and putting together for about the past month. And I quickly want to highlight 3 stories, main topics that have been going on in California. One of them is most recent, with the announcement of our California school university system announcing that a fall semester will be exclusively online. So here I ran a poll recently for my followers of how the CSU students feel about this continuing. And many do not want to continue with online. And it has been a topic that I've been keeping an eye on, also for at the University of Oregon. The plan is to hopefully hold in-person meetings. And of course, the fall schedule has been pushed back accordingly. But for California, our CSU system has about 500,000 students. And total in California, we have about 260 campuses ranging from CSU, UC system, private universities, and our community colleges. So here are some thoughts that I had on this thread going forward of just how the enrollment numbers will drop. Many lower income families may not be able to afford during this time, so students may not be able to attend, but also many students do not feel that they are getting the education that they are paying for with the online format. There is talks of possibly doing classes outside because SoCal, we have great weather, so it could be a possibility. But as of right now, our UC system has not announced whether they will be holding classes online or not. Here, I just noted that on Monday, the University of Notre Dame announced that they will hold in-person classes this fall. They plan to start August 10th and ending the semester by Thanksgiving break, so that will not pose the risk of students heading home for Thanksgiving and then returning to campus. And University of South Carolina also announced that they will be starting with in-person classes and then switching to remote. Yes, so here I noted that the UC system haven't made an announcement yet. Either way, this move of online is definitely going to affect the diverse student body at some schools. And then I also wanted to note, I can get there. Another great implementation of a program by our mayor, Eric Garcetti, was a newly announced assistant specifically for LA residents. It is called the Angelino card, and it is a prepaid debit card that has been given to households in LA. I have been following this because it is a nonprofit effort, and it is directly from the mayor's fund, so it is not funded by the city, and because of that, immigration status was not required for eligibility. It has been funded through private donations and the mayor's nonprofit. One of the private donations was from the Snapchat co-founder, and he donated, I believe it was $500,000 to the fund. And for eligibility of this Angelino card, you just had to be a LA resident and show your pre-COVID income, and also showing that you have experience hardship during this global crisis. The applications were open April 13th through 16th. I actually did go through the application, and it was very simple of just finding your zip code and entering in the household size and your income. Unfortunately, I did not receive notification that I would receive it. And unfortunately, there were many other residents also, but that's just because it is a nonprofit fund and it is privately receiving donations. So it just depends on how much is available in the fund and whether that resource can get out to these residents that need it, especially ones who have not received the stimulus check or do not qualify for unemployment. And another topic I wanted to list has been a pivotal point in California's reopening progress, and that is with Governor Newsom versus Orange County beaches. For May 1st, Governor Newsom implemented an executive order in place to keep all beaches closed. Of course, there were many different reactions to this shutdown, and protests did occur in Huntington Beach areas and Newport Beach. Here you can see my thread of thoughts on this. And Governor Newsom also noticed that the virus does not take days off, and it is more prevalent than ever. So there needs to be understanding of why these executive orders are being in place. Here are just some pictures of the backlash that occurred after the executive order. Here you can see this is from Huntington Beach, many not following the social distancing rules. And shortly after this, Huntington Beach also put in that they wanted to essentially sue Governor Newsom for the executive order being in place and felt that it was an overreaction of his authority. Shortly after the executive order was put in place on May 1st, OC Beaches got the green light to reopen on May 6th after reaching an agreement with the state. And currently, LA County beaches did open on May 13th. So as of now, all beaches are open, and with our weather starting to heat up, many are still flocking to the beach. But the main concern was the congregating and the lingering in these concentrated areas and having the high volume of people in a space. It wasn't not being able to go to the beach, it was just that concern of having that volume in these areas. But now beaches are open for recreation use. You just are not allowed to sunbathe, kind of spend the day out on the sand, no picnics of any sort. It is just for walking, jogging, swimming. And I just want to note one poll that I did run. Right here on May 8th. This was when California went ahead with reopening guidelines. We moved into phase 2, and I ran this poll just to see people's thoughts on the reopening. And as I continue to follow it, I continue to remind that with reopening, many people will continue to go out, and we need to be kind of that. But many people will decide to stay home also, and we need to be understanding of that also. And there needs to be continued understanding of the guidelines that are being in place and why they are being in place, and that we continue to follow the health stats and the data that is being, and the science that is being done, and not just ideology. And I will turn back to my PowerPoint real quick. And here I just wanted to note Governor Newsom's roadmap that he has implemented for the state of California. We are currently in phase 2. But as of Monday, many counties have gotten the go-ahead to move further in phase 2, and this is all up to their own counties, their own variants. They have the opportunity to move at their own pace. For Los Angeles County, we are still in the beginning of phase 2. We still have a long ways to go as our numbers are still increasing, and we are still seeing more confirmed cases and deaths each day. We have slowly reopened, and I believe that it will continue to be a slow reopen, and we will be behind the rest of the state, but it is coming from great public health directors and public health officials that are following the science and the data of our county and noticing that with our population, the reopening will need to be slow. Thank you, and that will be it for me.
Okay, so turning it over to me, let's see if I can figure out. That's not what I wanted to click. Sharing my screen. Okay. Can everyone see that? Guess I should make it so I could see you guys to tell me to say yes. Okay. Hi, my name is Angelique. I'm a senior here at the University of Oregon. I'm majoring in French International Studies, and as Professor Yarris previously mentioned, I'm in her global health class, and I'm minoring in global health as well. So for our project for this course, I decided to focus on the government response, epidemiology, and impacted communities in New York. I don't have any personal association with New York, but I decided to look into it just because it so quickly became the center of the pandemic in the United States. And I thought it'd be interesting to look at how one of the most impacted places handled the pandemic. Okay. Just a little bit of data for you guys. As of last night, these numbers are accurate. There was approximately 1.5 million people tested, and approximately 350,000 people tested positive. Nearly half of that, almost half of that, was in New York City alone, and there are still over 50,000 people hospitalized in New York City, not New York State. Confirmed deaths in New York State are nearly 23,000, and of that, a little over 16,000 have been in New York City. So they have been seriously impacted by this. What does this data mean for New York? It's actually good news. It's still not looking great because they have been so severely impacted by the pandemic, but based on the data that we've seen so far, they're nearly back to how things were in the beginning. If you can see on the chart on the right, the blue is total of persons tested, and the yellow is people tested positive. So even though testing has remained in the tens of thousands daily, positive test results continue to go down every day, which is paving the way for reopening the state. Epidemiology of the disease, the first case appeared March 1st, and following that, the majority of data that was collected showed that, unlike what the governor and a lot of other health experts believed, the majority of new cases were not originating from essential workers, but rather from people who were staying in their homes. So I was confused by that, as I think a lot of other people would be as well. I'd have to look into more how that's possible, but the people who were going in, being hospitalized and getting tested were saying that they had been almost exclusively at home and not leaving their house more than once a day. Of the cases that were seen in New York, 89% of fatalities that came with them had pre-existing conditions. And it's difficult to look at the number of cases overall in New York and get a good picture of how this virus is impacting people. So I chose to look more specifically at fatalities that came with it, because that was, it's just a more concrete number, because there were so many cases that are minor or did not go to the hospital, haven't had testing, or haven't done antibody testing yet. So it's not clear whether or not they have been impacted by the virus, to say. But looking at fatalities made it a little bit easier. When looking at the comorbidities of fatalities in that 89% of pre-existing conditions, the majority of them were hypertension, and the second largest were diabetes, both of which are associated with older age and obesity, and both of those did show to be consistent with those who were dying from COVID or being most impacted. In New York, the high-risk age range was deemed to be between 50 and 89, which I think is a little bit lower than was seen in other states. Not because people are getting sicker earlier, but just because when looking at the data, the number of people between 50 and 59 who were dying of COVID was like half of the amount of people between 60 and 69 who were dying of the coronavirus, but that number in the range of 50s was still significantly higher than what was being found in people in their 40s. And on the right here from the New York City Health Department website, you can see the deaths related to income levels, which is something I definitely wanted to look at when I was looking in New York, because I understand the disparity of wealth within the state. So you can see that very high poverty, really low income has had a significant impact on who is getting sick and who is dying from the virus in New York State. Government response policies, something that Governor Andrew Cuomo did early on, directly, I think it was March 2nd, directly following the first case, was implementing orders that worked as to lessen economic strain on New Yorkers. Utilities were ordered to not be shut off. And the 7-day waiting period for unemployment in the state was waived, so you no longer had to meet those waiting period requirements to get your unemployment. And there was an eviction moratorium, which was really important for New York residents, especially within New York City and the metropolitan area, because rent is so high, and many of those people fully lost their incomes. And in transition to getting unemployment payments, there was a lot of fear about that. I believe this eviction moratorium has been extended until August 20th to cover the backlash or the aftermath of the virus for people in transition. There were a lot of small steps and executive orders taken directly following the confirmed case in New York and leading up to the large shutdown New York pause order that went into effect March 22nd. A lot of these were smaller and slower and more pointed to regions. So initially it was a regionally focused shutdown and closing of certain businesses, and very soon after, only a few days, the entire state was limited. And then a few days after that, he moved more into full shutdown for the state with the pause order. And that encompassed social and physical distancing, remaining 6 feet apart, all non-essential businesses closed, and non-essential gatherings of any size were limited. And I believe this was a little different than what was found. I know it was different than what was found in Oregon, because I believe it's not recommended, but you're still allowed gatherings of up to 10 people. But in New York, all non-essential gatherings were restricted. I think it was like Oregon, like was found in Oregon, there's been a lot of partnership with surrounding states, New Jersey and Connecticut in particular, to help restrict the spread of coronavirus within those states because they are so densely populated and so closely tied. Governor Andrew Cuomo did not feel that progress could be made in restricting the spread of the virus without partnership of these states and the surrounding areas. And that actually happened before the pause order was put in place, but they've continued to work together after the pause order and into reopening. There actually was something, mandatory face coverings were instituted in public on April 15th, and I believe that's different than what I've seen in other states. I haven't seen any mandatory face coverings for residents, but I could be wrong. Please correct me if I am. I know that it's been for essential workers, but for the entire state of New York, if you are unable to maintain social distancing, especially in the crowded streets of New York City, all residents are required to wear face masks. And moving into reopening, it's regionally focused, like many of the decisions have been in New York. There are 7 criteria that need to be met. I'm not sure how much time I have, but I will leave for you guys to read those. They're on the bottom left. Those are all the 7 criteria that need to be met in each region in order to reopen. As of right now, I believe only 5 of them have met these criteria. Originally on the reopening date of May 15th, only 3 had met the criteria, and New York City, like Kings County and the Bronx County, they are still nowhere near moving towards even the first phase of reopening, but hopefully they will get there soon. And when it comes to all 4 phases of the reopening, which are on the right side of your screen there is no set date for those whatsoever. Cuomo has been very adamant in his press briefings that there is no date, there is no timeline given. It is all based on local governments and the numbers that they're showing. And even with the reopening, he has encouraged local governments to make their own decisions about what they will allow, because there are some things that are going to be allowed with phase 1 and phase 2 reopenings that some local governments may not want to be happening yet, and he's given them full liberty to make those decisions for themselves. Another really, really important thing for, I think, this country as a whole in the pandemic, but especially New York, is the contract tracers being put in place. He's made an effort to hire thousands. He did not give a specific number in his press briefing, but he said thousands of tracers. I know some of them have already trained and began their implementation, and others are being trained currently to do this job. That's all for New York specifically, but I have here something it's a comparison for all of our states. You can see California had the first case, followed by Oregon, then New York, then Colorado, but the timeline for reopening in accordance to that has been very different. California had their first case back in January, and their stay-at-home order didn't start until March 19th. For New York, it was very different. They had their first case March 1st, March 22nd, everything was shut down, but that had to do with how quickly the virus was spreading. Yeah, if any of my other panel members had anything to say about the timeline, this is a perfect time. No, if not, then that's all I've got for you.
Okay, great. So I think, I don't know if you want to leave that timeline up or.
Yeah, I can if you'd like me to.
I'm not sure, but now is our time to take questions. So I think.
We do have one question in the chat if we want to start with that.
Yeah.
Okay, the question.
Do you want to read that?
Sure, yeah, I'll read it to you. It's from Mike Schill. If you were advising a governor or a university president, what would you tell him or her about reopening? There are risks in staying closed, bankruptcies, unemployment, and all the cost to vulnerable populations of poverty, and ultimately risks in opening, illness, death, disparate incidents to vulnerable populations. It is hard to imagine reopening without someone getting sick. Should risk be 0 to reopen?
I I can answer this or
Sure.
are we doing, is this directed at one person or all of us?
All of us, I believe.
Okay. Personally, I don't think that the risk needs to be 0 to reopen, because I think the risk to be 0 is quite impossible, frankly. And like the interview of the former CDC deputy director that I was showing earlier, he doesn't think COVID's ever going to be beat. Just how the flu is never going to be beaten. And so if we continue to hide away and protect ourselves for as long as possible, I think the economy will be hurt more than it needs to be, personally. And if I was advising a governor or a university president, I think that it really depends on the population that you are governing. And so if you're governing a high-risk population or versus a college student campus with very few high-risk cases, I think that those are to be taken at different levels, and that you need to consider very different factors that will play a role into how many people are going to get ill and how many people are going to be hospitalized. And I think if you were a governor, I think that you need to pay attention to the number of declining cases in your state. And like Colorado, personally, I think we opened too early. And I think it's because we opened a day after we had declining cases, and it was like 12. It was a declining case of 12 cases. Like, it was not enough to open yet. I think you need to have a number of declining cases for weeks, and it needs to be a significant amount of declining cases before you can just go ahead and reopen. And you need to reopen slowly, like most of the states, all of the states that we were talking about did. You have phases, but it needs to be in a way that you can maintain the economy through curbside pickup, through takeout, through whatever you need to in a safe manner, whether that's wearing masks, staying 6 feet apart, in order to continue to stay open and protect the health of people while also maintaining the economy. And from a university standpoint, I think it's a little easier because you have a lower risk population. And granted, there are high risk students depending on whatever comorbidities they have. But I think that it needs to be a consideration based on putting the students' health first and economy second. And you can do that by looking at the number of cases in your state and giving students options. So giving them online classes as an option, or giving them an opportunity to go to class and sit 6 feet apart. And it should be up to them. There should be no penalty for missing it, because you can still do it online, because you can still do it in person. And there should be all these different options in order to continue educating students at the best ability that the professors can. And
that was a great answer, Amelia.
Yeah.
I would say much of the same thing. I don't think there is any 0 risk possibility when it comes to COVID. I don't think it's possible for us, even with the vaccine. There are still going to be risks that come with it. From a governor's standpoint, I would say listen to the health authorities in your community, within your state, from the CDC. That's what is probably most important. From a university standpoint, like Amelia was saying, we are a lot lower of a risk. We're a lot lower of a risk population. So having the option to be in class for students who do need it or who learn better from that standpoint is probably a really good solution, but also encompassing the economic strain that came with this for students especially at UO, because I know myself and others in particular who have been seriously impacted by this economically and didn't see any change to tuition fees and all of that. I think thinking about that as well is important.
Myriah,
Yeah,
would you like to weigh in? Yeah.
Oh yeah, I would love to just add that I definitely agree with you guys. I think we've seen in each of our states and across the country, when governors and whoever's opening relies on that public health information, that's really the safest way. The case numbers, what are the public health officials telling you is okay and what's not okay? And then delivering that information to the wider public in a way, limiting kind of fake information about how the virus spreads, things like that. So I think we need to have informed leaders and informed populations, and that will make opening, whether it's a whole state or a university, much safer for everyone.
Yeah, I just want to add that I feel the focus should be on preparedness. So what is the testing capacity for the population? Do you have the sufficient personnel for tracing contact? Are you working closely with the hospitals, with the nursing facilities? But also, what is your plan, like if a surge occurs? What is your preparedness for that? Unfortunately, there will be risk. There will not be zero risk for probably up for the next year or so, but are you able to protect your essential workers when you are reopening? And this global crisis has grown to an economic crisis, and it is definitely spotlighting that economic policy is health policy. If we were more prepared before this, numbers could have been different, stay-at-home orders could have been different, but also our residents, our population, the citizens would have been able to stay at home financially. The progress and the wanting to reopen is coming strictly from not being able to pay for things right now and being out of work and not receiving that assistance financially. So if we possibly were prepared and had these programs already implemented, say instance of the stimulus check, if we possibly had some sort of thing already implemented, it would have gone through quicker, and we would have been able to really sustain longer for our stay-at-home orders. So I hope that we are able to keep these programs, because another crisis will occur within the time, and it won't also necessarily be a global health crisis. It could be a natural disaster of some sort, really hitting a state, a population of sort. But just having this thought of having this programs implemented to be able to sustain our population to stay at home during a crisis of sort will help our health outcomes in rates of transmission, of just testing capacities, and our global health, public health infrastructure of having this robust system. So I would just say the focus now, as we catch up to this virus, and as the science catches up also, would just be the preparedness, the focus of preparedness, and if you're going to take measures of reopening, allowing students to return back to campus, what are you implementing to support, not only in the classroom, but just health-wise, of resources? Are like centers on campus able to hold capacity of what could occur of a risk for the student body? Yeah, and just being prepared for if a surge of sort could occur.
Thank you. Those are great answers, everyone. So I have a set of questions, and I'll just pose them one for each of you, if that's okay, because I think I don't see any other questions in the chat box. So first of all, I just want to commend you all on this research and on presenting it in such a professional way. As I think it was Hannah who stated really clearly, you've conducted these projects in real time, following the impacts of the pandemic in these 4 states. And each of the presentations, I think, highlights different dimensions of the importance of a public health response. So I think to Hannah, what your presentation shows, as you just articulated, is the importance of clear public health messaging and communications. So I think my question to you is, how could state leaders in the US who've become so important during this crisis better use social media to really reach all segments of the population? We looked in our class a little bit about how the New Zealand Prime Minister has used Facebook Live to communicate to the public in really clear and direct ways. So Hannah, I guess if you were to design a public health communication strategy for Kate Brown's Oregon Health Authority, what would you say to her for readying us for the next public health emergency? So I'm just going to ask all the questions and then let you respond if that's okay. Amelia, what I really like about your presentation is we hear the voices of frontline health workers, and that's so important during this time. So I really appreciated that. And I wanted to know what, I think you might have said this, but I wanted to know what your plans were for sharing those interviews. Do you have a podcast in mind? And when you talked to those people and collected their stories, what did you tell them you were going to do with their data? And how did they feel about talking to you for a student research project like this? I was just curious about that. Myriah, having worked with you on this project over the last 2 months, it's just been really fun to see how you've used Twitter following other public health leaders to curate information and to make your own voice heard. I think it's really neat how you've been able to use Twitter to survey Cal State students, for instance, about their perspectives about returning to campus. So my question for you is just, what do you think about the role of social media, particularly to reach young people of your generation in a time like this? And just how have you, I've seen a lot of growth in you as a public health leader, and I just wanted to know how this project and your engagement has helped you sort of find your own voice in public health, which is really exciting for me as your mentor, but I wanted to hear you talk about that. Angelique, as your project points out so clearly, and as people like myself who teach in global public health aren't surprised, the pandemic has not been the great equalizer. It has in fact impacted populations according to socioeconomic and racial and ethnic disparities. So I wanted to hear from you more about that graph you showed us. What is behind those disparities, both by income and by race and ethnicity, whether it's in New York or across the US? In Oregon right now, about 25% of COVID cases are in the Latinx community. We know that in New York, in New Orleans, and other hotspots, African Americans have unduly been impacted. So what's your assessment about what's behind those racial and ethnic disparities or social disparities in COVID more generally, which is so important for us as we respond to this and other public health challenges? So maybe you just want to take those questions in turn, but really great work, everyone.
Great, I'll go ahead and get started. I think that is a really interesting question, and I think it's been brought about by the times that we live in. Lots of people use social media, therefore a governor utilizing social media, whether it's Facebook Live or a Twitter account or even an Instagram feed, is a way to really get information directly to people in a very digestible way. I think it can be really overwhelming to read through the news and you get the heaviness of it all, but not necessarily just the pure information that you need. I think social media is also great. Say if the governor, I followed her Instagram page and then I was able to reshare her posts. And so I just think it's a really good way to quickly spread information. But with that in mind, I think we also need to be considerate of the older people who don't use social media, maybe the people who live more in rural areas and they don't really have that kind of access. So I think any sort of public health campaign put out on social media needs to include phone lines to call into, announcements on the radio. Really don't leave behind those more traditional ways of people getting information. I know that the university set up a coronavirus hotline, and in the beginning, I called that to get information. So I do think it can be an addition, but it can't be the only method of sharing information.
Okay, so I created a video for the interviews, as you guys saw, and the video will be posted on YouTube when it's fully complete. So the reason I only showed you segments is because it's very long and it wouldn't fit in this time. And actually the former CDC deputy director, he also worked during the smallpox eradication time. So part of the full video is a comparison kind of on how he worked in India. So it's a little bit of a different comparison, but just kind of on the public health methods on eradicating smallpox and what we need to do to kind of adapt that and apply it to COVID-19. So it's a really interesting perspective from his part. And so I actually knew all three of these people personally, which is why they were so readily available and willing to participate in this. And originally I actually told them that it was going to be a podcast and I was going to create a podcast, and that proved a little more difficult than anyone expected. And so we turned it into a video, and they were all totally fine with it, and were really supportive in it all. And as you can see in that video, like, they gave perfect answers. They were so honest and open about everything, which was really helpful in determining the actual role that Colorado played in COVID response. And yeah, so it's going to be up on YouTube to answer the beginning question.
Yeah, so just with the role of social media of reaching the younger audience, social media has continued to be a platform that people are able to easily access and just have with them at all times, whether just scrolling through the apps or just searching the internet. And when I chose Twitter, I thought of it in that way of just having it readily available and there for my followers, but also just people in my community who may not be necessarily following directly the news outlets, watching the daily briefings, but still wanting to have that knowledge, that update of what is going on without having the overwhelmness of all the news being put out. So that's why I chose the Twitter platform. And it kind of grew a bit once I started, once I kind of started tweeting things. I had some friends kind of retweet to help me out. And then as they retweeted, their followers retweeted, and even if they weren't following me, they were still reading the updates, the articles, the information that I was linking on there. So they were still able to be involved, feel like they are understanding what is kind of going on aside from all the briefings and reopening guidelines and just everything going changing each day. So that's why I feel that social media will continue to be a great resource, and it will continue to be something that will continue on with our news outlets and as we continue to follow this global crisis, especially for the younger audience. And just for my engagement of this project, I did not expect it to be what it is now. I kind of started, only had a couple followers, but I have about 38, so yay. But just also being able to gather and analyze these kind of topics and areas of interest and putting it out there on my timeline, and getting to really just voice my own thoughts towards them, creating those threads, and being able to pick certain things that I feel that really would resonate with maybe students of my age, people in my community, and just others that will see it, instead of just kind of throwing everything out there. I really wanted to stick to these areas of interest and really curate information on that, and just highlight the main ideas that I find, and yeah, continue to just add my own analysis and my own voice to these things, and really pose some questions for others as I ran those polls, and questions for myself also as I grow this interest of public health and global health, that I hope to continue with, and really continue to learn and advocate for populations. But also, as I continue this project, I kept with me the idea of that we will never know if we overreacted, but we will know if we didn't do enough. And that is something that I have really kept on my mind as I continue to analyze and put my thoughts in and curate this information on my Twitter page of just, there will be oppositions, there will be different sides to this. But we will never know if we didn't do enough by just, not taking the protocols that we are doing, following the guidelines, and we must continue to do so if we are to continue through this difficult time.
Yeah, and just responding to your question about what's behind these disparities, the graph I showed was, it only showed deaths in New York City in accordance to income. If you look at the graph for the city, for cases and hospitalizations, it shows something similar, but the disparity isn't as significant. I think the fact that so many more people of lower income are dying from COVID-19 has something to do with lack of access, but not only lack of access, but fear of accessing these services because of what comes with accessing these services. Healthcare in this country is incredibly expensive, and there are many people with low incomes that avoid seeing a doctor until it's absolutely necessary. And with coronavirus, we've seen that when it's necessary, it's almost over. It's when you get to the point that you're on a respirator, very few people are surviving. When you get to the point that you're being hospitalized, it's usually for severe cases. And those that are waiting and getting confirmed and in the hospitals, those are the ones that are dying, the ones that are not getting the help that they require. I think it also has, what was I gonna say? I think it also has to do with the environment in which we're looking, because this was New York City. The population of New York City is a lot more diverse, ethnically and in income levels. So I think if you were to look at the state as a whole, you probably would come to the same conclusions, but it probably wouldn't be as linked to income levels, just because within the city there are so many African American and Hispanic people who are of lower incomes and who are getting sick at higher rates, and there are many comorbidities associated with low income that lead to greater risk of dying of COVID.
Great. I think we have one more question.
Yes, we've got one more question
Yeah.
from Mike in the chat. How do you think about the possible curtailments of civil liberties that might be necessary to go forward? By this, I mean requiring people to wear masks who don't want to, or tracing contacts.
I think I'm going to add into this question, all of you as students of public health who studied the contemporary pandemic and social distancing responses in light of other public health laws historically, like policies against smoking in the workplace, or the simple fact of federal laws on seatbelts. So how do you think about the current moment, for instance, mask requirements or not? As we saw across these 4 presentations, there's disparate requirements on masking in the US, while other countries have taken universal masking approaches. But how do you think about, in light of sort of the US history of public health law more generally? Any thoughts about that? It's a great question.
I think I'd like to just highlight that here in the US, I think it takes a long time to make those cultural shifts, especially if the impression is that your liberty is maybe getting minimized in some way, such as having to wear a mask when you don't want to. And I think like the example with smoking, that kind of took a long time to phase away from that when everyone used to smoke. So I think that we urgently need these changes in our behavior, and I think culturally that will be very hard to achieve in the US, and that will kind of diminish our response on the public health level.
I'll just go ahead and add the question of wearing masks and people don't want to. This actually has been a topic that I was going to follow today that I found on Twitter from actor Dan Levy. He spoke on this yesterday and just talking about how think of wearing the mask as an act of kindness for the day. don't think of it as an infringement on your freedom, but rather you have the freedom to leave your house, and you have that good health to leave your house. So why not just put on a mask for the day, and just have it be your act of kindness for it. There will continue, to be both sides of this, of not wanting to wear a mask and wanting to wear a mask. But I think we need to take that approach of the continued kindness and just having that understanding of these measures that are being in place, and just wanting to just think of it in that way. And when you leave the house, think of it as you're wanting to help others and protect others as well.
Yeah, I completely agree with both of you guys and everything that you said. And just to add on to it, we're wearing masks to protect others, along with protecting ourselves, but we're wearing them to protect others. And so I love that act of kindness method by putting it on to help others, And like Hannah was saying, culturally, it's not, in America, it'll take a while to kind of not force, but to get into that mindset that we need to wear these for the optimal health of other people. And I think the sooner that gets into the mindset of society of America, the better that will be. And we need it, like the sooner that we wear masks when we're flying, when we're going to grocery stores, when we're going anywhere with groups of however many people, the sooner that we can overcome this, and the sooner that the number of cases declines, the number of deaths decline, the hospitals are not overwhelmed anymore. It's just like this domino effect. And so I think that needs to be instilled into the mindset of the people of America before really anything can happen. And unfortunately, I don't see that happening soon, just because so many people are focused on our freedom, and that's really the Constitution. And it's one of those things that we need to change our mindset, like New Zealand or Taiwan, all these countries that are doing such a good job. They are having masks worn 24/7. They're following up with every single citizen that is diagnosed. And it's just a completely different mindset.
Yeah, if I were to add anything, I would say, Amelia, your wording of describing this encompasses it pretty well. People don't want to wear masks, but it's a desire not to, when what we really need to do for public health is to wear them.
Thank you. Those are great responses. We really see in the US, as you all are pointing out, these underlying cultural values of fierce individualism coming into tension with public health ideologies of prevention and collective response. But like Hannah pointed out, with smoking norms, it took maybe a while to shift, and now we're asking people to make behavioral shifts really quickly. And yet I would think if we all started seeing smoking permitted on college campuses or in workplaces again, we would see non-smokers say, what about our rights, right? To be protected from secondhand smoke. So, we'll see how this all plays out. And I definitely think here, as Amelia pointed out, the cross-national comparisons are so useful because where masking has been just a universal policy, there's less ability to opt out, right? We see the same around immunization coverage in the US, where we give people the opportunity to opt out. We see the rise or reemergence in infectious diseases that we thought we were over, like measles. So there will always be, I think, in the US, this tension around individual rights and the right of the public to have a healthy community. So I think your answers really show you're able to grapple with those challenges and those contradictions. So we're probably up against a few more minutes of time. I'm not sure if Katherine, you've been moderating, if you have any questions for the panelists or any thoughts to share before we wrap up.
No, not any questions in particular. I just think you all did a really great job, and it was very interesting to see how different parts of the country have been responding to this. I mean, I grew up in Oregon, but I lived in LA for a short time, so it's interesting to see how things are going there. And yeah, I really learned a lot, so thank you.
I just want to thank President Schill for being a part of our session this morning. It was amazing to have the participation, and I want to commend you all again on putting together these projects in real time as a crisis was unfolding and as you were dealing with it in your own lives. It's also really neat to see that you used your locations, for some of you in Colorado, Oregon, and California, as sites of study and research engagement. So we created out of this crisis a real opportunity to have this state level comparison, and you did a fantastic job. So thank you for working extra diligently to put this panel together. Yay. Virtual high five.
Well, I think I'll go ahead and stop the recording.
Yes. Thank you, everyone.